Hi everyone, this is Dr. Korous, and we have Sweet Lisa here today.
Aww.
Thank you so much for coming to our show.
Oh, thank you so much for inviting me. I'm so excited to be here with you today.
Thank you so much. And today marks our third week of podcast, Tea Time with Dr. K.
All right.
And we're so thankful that Lisa is here with us today to share her journey. She found us to begin with, and her whole dental journey so far.
It has been a journey, a great one though.
A great one.
Yeah,
Okay.
It's been amazing.
So would you like to let our audience know how you first came to meet us, Millennium Smiles team, and me?
I don't live very far from here, so I would make drive-bys often, and I knew that I needed some treatment. I knew that I had an infected tooth, Dr. K, and so I stopped in. It was kind of late in the evening, and I came in, and there was Susan. Oh my gosh, she just
she's so
embraced me. She just embraced me, and she reassured me that you all could help me, whatever my situation was. And I said I wasn't sure, and I said that I'd check back with them later. And it was Susan and another doctor. He was I can't remember his name.
Dr. Ryan?
Yes, Dr. Ryan.
Yeah.
And they were both so kind and
Thank
so
you.
gracious. And I was like, I think this is the place. I think this is the place. And it has been the place.
It has been the place.
Yeah.
So then you came in, and maybe walk our audience. Because sometimes a lot of patients, what they feel is they get a lot of dental anxiety or dental phobia. And I think you had a little bit of that as well, right?
Yes.
If I talk about the scale from 1 to 10, what was your anxiety level like just going to dental office? Not just us, but any dental office.
An 8.5.
Okay. And I'm gonna ask at the end when you journey, going through the journey, how did we change that for you, and what is it now? And what did we do to maybe soothe or comfort you through the whole journey of you getting comfortable over time with us?
Well, I think what was most important to me was that you all not only cared about my dental needs, you cared about me as a person.
Aww.
You cared about me as a person. I felt that.
I know. We love our patients, and they come here. we like, look at her. She looks like a celebrity all by herself. I mean, come on. But that's how we see our patients. I mean, they're part of our family. And
yes. It feels like a family. I mean, I've never enjoyed going to the dentist. Okay, who does, really?
Yeah.
But I look so forward to coming and seeing you people here. You're like my family.
Thank you so much. We get to know our patients, especially the ones I would love to share more. We want to know what's going on in their life, and we want to, and I actually part of my life journey as well. And so it's, my life journey, I've actually lost, and I said the left journey, I'm going to tell you guys, I lost 30 pounds over the past several months, and it's been an amazing journey. And there's no diets or anything like that. It's just,
hard work
and dedication and consistency. I think that's what really pays off. And of course, gym and Pilates and, red light therapy and sauna and stuff. But it's really a constant dedication, right? And so with us, when we deliver our services.
Right. Well, when I first met you, you were so glamorous, so beautiful.
Thank you.
And I thought, well, I wonder what she's like on the inside. And she is spectacular on the outside, and she's more spectacular on the inside. She's very genuine. And you know what? She is ferocious about taking care of her patients. She wants nothing but the best for her patients.
Thank you so much.
Yeah.
And I feel like you see the consistency of that.
Oh, yes.
Over and over again.
And you know what else?
What?
Sometimes I'm in here and another patient will come in. They get the same treatment. They get this. It's just not for certain people. It's across the board.
Yes.
Yeah.
We don't discriminate against culture, race, background, ethnicity, even language. I mean, I speak a little bit of Spanish, not a whole lot, but I do my very best to even communicate with that. And we want the patient to have that experience of feeling welcome, understood, heard, loved,
comfortable.
Yes.
Comfortable and confident. I'm confident that whatever issues come up, you will take care of me.
Yeah. Thank you.
Yeah.
Thank you.
That's the truth.
Appreciate that. So would you want to let them know so far? And you know what? I'm going to say something about you though.
Uh-oh.
To go through this journey and be confident to sit in this chair while she's still in the middle of treatment. that is a testament to her own journey of changing her
Mhm.
anxiety
Mhm.
at an office, but also being very kind and honored to be in your presence, for accepting to even come to the podcast
Aw.
when he's still not done with the treatment.
Well,
And so I appreciate that so much.
oh,
I
you're
really want you to know
welcome.
that.
You're
So
welcome. I just know where I started with you, and I am now waiting on 5
implants,
implants
crowns.
crowns to be completed,
Yes.
and I'm so excited.
Yes.
I'm so excited.
Thank you.
Yes.
So what you want to tell us, like how it started, like as far as the infection and what we ended up doing and all that stuff. So
Well, I noticed an infection back in 2022, and I was living in Michigan at the time, and I tried to have it treated there, but my experience was it was horrible. Dental office, and
so you had anxiety.
I had anxiety, and he had no patience. So it was.
They don't go hand in hand.
No, it was a disaster, and so I was in the chair, and he was about to work, and we finally both just said, this is not going to work. It's not going to work.
Yeah.
And so when I moved back to Texas, as I said, I would pass by, came in, saw Susan, Dr. Ryan, and
Felt at ease.
Yes, because they just totally embraced me, and they listened to me, and so I thought, well, I'm going to come back and see the doctor, and voila, voila, there's Dr. Korous, and I didn't know it was as bad as it was, but you were so matter of fact about fixing it, about treating me, and I felt at ease. And with every treatment, every time I've come in, I've received the same amazing care.
Thank you so much.
Yeah. And I know that you have my best interest at heart. I know that you're going to do what needs to be done.
Yes. Yes.
And I appreciate that so much.
Of course.
So we started in January of 2024, and here we are, November. Yeah. And I would not have wanted anyone else in the whole wide world to ever have treated me but you.
Oh,
yeah.
You're so sweet.
No,
Thank you so
much.
Thank you so much.
Yeah.
So you went through, like, may I share what you have gone through?
Yes, please do.
So she went through some, infection. We had to actually extract do sinus lift and bone grafting, and be able to place implants. So it's been a journey.
Yes, it has.
So extraction, cleaning out the infection, and let it heal, and bone grafting, and then also sinus lift. And
what was really important is that you decided you need to be you need anesthesia. You need to be put under for these. And
correct.
Oh my gosh, it made all the difference. It was exactly what I needed. We tried it once. The first time we tried it without. And then you said, no, we need, this is what we need to do.
Exactly.
And it made all the difference.
Yes. And and the thing is that I rarely offer anesthesia for like procedure, but I feel like a patient, especially at the first time, builds up a lot of anxiety and needs a little bit of extra help to overcome that, then definitely anesthesia is the way. I mean, we do different type of sedation. One is complete anesthesia. When the patient is mildly awake, but they don't necessarily know what's going on, and there's a conscious sedation, and there's, of course, nitrous. So there's 3 different sedation that I offer in my practice for anxious patient. But what I think in your specific case, because we need a lot of work and extraction and grafting and sinus lift and implant placement, which we placed 5 implants.
Yes.
And
you were point on. I mean, that's exactly what I needed.
Yeah. And so she actually just went through whitening yesterday.
Oh my goodness. Oh my goodness. That was pretty amazing.
Yeah.
I knew that they would be whiter, but when Angie kept coming back with whiter and whiter, and she's like, "You're in the bleaching category."
Yeah, you're in the bleaching category right now. Yes.
So I'm excited about you being able to.
You actually did core whitening, right?
Yes, core whitening.
So can you tell me a little about the process, how we started it? Because she did mention to me before we go to the implant crown stage that she wants her teeth to be whiter, and so what I mentioned to her is that if you want to get whitening done and you want to whiter crowns, and it needs to be right now before we take the impression for the final crowns, because then I want your teeth to be in a stage where you're going to be happy with it.
Right.
Of course, she has to maintain it. That's why we have to make another tray after everything is said and done, so that she can continue whitening the teeth that she has, not the crowns, but the teeth. So we started the process and let them know how it went. You came in and we made you a digital scan of your teeth.
Yes.
And they went to a lab where they fabricated like a bleaching trays.
Yes.
So you bleached 2 weeks at home, right?
At home, and then
to get you like up and running and going for the whitening and getting ready for the in-office professional one.
Right. That helped the whitening here in the office. The whitening at home helped the whitening here in the office, and so it was a very simple process. I was wondering if it was going to be some bright light in my face, or something, but it was very gentle.
Yeah.
It was 2 15-minute sessions, and it went seamlessly. Angie was amazing. She monitored the whole process, and I think that the process couldn't have been better.
Thank you.
Yeah.
Yeah.
She is an amazing professional, and I would do it again. If ever.
And you can actually, because once we take the implant crown impression and deliver it for you,
Yes.
we will be able to get a bleaching tray, like a new bleaching tray, so you can continue bleaching after. Like I would say, maybe do it every 6 months or so.
I was just about to ask you how often you thought I would do that.
Yeah, you maintenance, like kind of like you do a car oil change. The same thing. Like if you did a whitening, then you want to kind of maintain that, and that bleaching tray after all the crowns are delivered, then that's going to be able to do something for you then.
Yes. So I guess this core is so much different from what I had years and years ago, because I remember some white.
So that's called Zoom whitening.
Okay.
It's a little different. And then we also call boost whitening. So we do have boost whitening, which is just in office. There's no before, there's no after.
Okay.
But core whitening is more of an enhanced because it's several shades, makes your teeth lighter. Although, just remember this, when we do whitening, the amount of like whitening we can get on a tooth depends on the inner layer of the enamel. It's called dentin. So we can get it as white as the inner layer of the enamel is, and that's really with all bleaching. Okay. So that's how we can. So the fact that it got lighter and lighter, because the inside layer of your, like the layer below your enamel, was as white. That's why we could get it a little lighter too.
I see.
So that's how it really works. But different bleaching product can do different efficacy, like as far as enhancement of the whiteness. Okay. So that's why you started with core whitening. We get a bleaching tray before, you do 2 weeks of whitening before you come to the office, and then you do the in-office professional whitening, and then you maintain it afterwards as well.
Right. Okay. Yes. I'm very pleased with the outcome.
Yeah, I'm excited for us to go to we're actually taking her shade today, right?
That's right. We're going to pick the shade, and you're going to enter that into the computer, right? Send it off to the lab.
Send it to the lab.
And they're going to fabricate my
implant crowns. And we're super excited because, it's been a journey for her, but she has been amazing and very understanding all along.
Wait, you know what blew my mind was the 2 crowns I had to have. You were able to fabricate the crowns right here in the office. I thought that you were going to put on temporaries, and I was going to go home, come back 2 weeks later. No, the same day.
Yeah, so that's awesome. What she's talking about, so we do implant crowns that goes to the lab. But if a patient ever needs a same-day crown in the office, like another crown in a natural tooth, like that has cavities or big restoration or a silver filling that needs to be replaced, and we offer same-day crown. We have a machine in the office that
awesome.
That's
so awesome.
I know. After we prep the tooth and design it, digitally scan and design it, we put it in the milling machine, and then trial in the purple stage in the patient's mouth, and then we put it in the oven, which it crystallizes and become like a exact tooth color shade that she wants it to be, and we deliver it for her the same day. And you were served either like a breakfast or lunch. I don't know. It was a smoothie or
I had an amazing smoothie. Oh my gosh!
Yes.
Served on a tray.
A gold platter? Was it gold or silver?
Platter. I can't remember which. I was enjoying your
massage chair,
drinking my smoothie, and being monitored by your amazing staff the whole time.
Thank you.
It's like it was like a day spa, sort of, kind of.
I appreciate that. That's what we tried to create. we want the dental office to be fun and exciting, and not just about coming and get dental work done, but we want it to be like feel like doesn't it smell like a dental office? First of all, does it?
Doesn't smell, doesn't look like a dental office at all. It's beautiful. I mean, it's worth coming in just to take a tour of this.
And maybe take some pictures with the Christmas trees.
Oh my gosh, yes, it is top notch, just like Dr. Korous and her staff. No, seriously, I'm not just flattering you.
I know. Thank you so much.
I mean, who likes to come to the dentist? But after you come here, you won't mind coming at all.
Yeah,
to the dentist.
Thank you so much. And Sweet Dimity always prepares these questions for me, and I happen to not look at them often. This time, it's like anything else any final reflections about your small transformation, and how it affected your personal life or maybe professional life.
Well, I am retired. I'm a
nice.
Retired flight attendant.
She has freedom. Don't we all wish to be that way?
Yeah. Well, I was just, my spirit was so low when I came here because of other issues going on in my life. I was on the back end of a divorce, and just things in my life were just not where I wanted them to be. And then on top of that, I had the issues with my teeth and my gums and my, oh yeah.
Thank you for sharing. Oh my gosh.
Yeah.
That's very sweet of you to do that.
So I just believe that God led me here. I think I'm pretty sure I know He did. He led me here, and I got the care and the treatment that I needed. I got the love also that I needed. Right?
We love you for sure. You know that.
Oh my gosh, yes, I feel the love, and so I feel like all of the issues that I had have been resolved. And so now I'm just waiting for the implants, and I can't wait.
The implant crowns.
The implant crowns. I can't wait for those to come in about 2 weeks or so.
Yeah.
And you're just gonna pop those in, are you?
Yeah, we're just gonna tie it in and then seal it, and no injection, no shots, nothing.
Oh, amazing!
And it'd be done.
Wow.
I mean, she just then keeps up with her cleaning appointment, and just that's
I just had a cleaning yesterday too.
There you go.
And that was really fast.
Yeah.
I was so used to,
because we educate, right? We along the way educate our patient. Hey, make sure you floss. Make sure you do this. Make sure you do the brushing. So, so when the patient does their work at home every single day and is consistent, then when they come to the office, all we have to give them is praise because of how much wonderful of a job they've done.
And you sent me home with this toothpaste that I have very sensitive gums and teeth, and
it really helped, didn't it?
Oh, I noticed a difference with the first
time or the second time.
Yes, and it just got better and better and better.
Yeah.
Yes, that what is it?
Fluoridex toothpaste.
Oh my goodness.
Yeah.
That's all I'm going to use from here on. Really?
Yeah.
Yeah, it was pretty amazing.
Yeah, it helps with the sensitivity instantly.
Instantly.
Yeah.
So if you have sensitivity, you need to get in here and get that toothpaste.
Yeah.
Really, you do.
Thank you. And then any advice you give to anybody else considering going to a dental appointment?
Yes. If you have anxiety, great anxiety like I had, I don't have it anymore. I would really suggest that you come in and that you experience what I'm talking about. I suggest you come in and meet the staff, take a tour, and meet Dr. Korous, and give them a chance. You will be hooked. You will be hooked. I don't think you'll be sorry at all. Yeah. So please come to Millennium Smiles today. If you need a cleaning or if you need a crown, you should come here. You owe that to yourself.
Oh, that's so sweet. Mm-hmm. And can I say something else to you? By the way, she's in the middle of her treatment. She actually has a
copyplast.
It's a copyplast. It's a clear aligner, and that fills up the gaps or the spaces that she's missing in her mouth. And again, I can't thank her enough to be confident to sit on this chair and talk the way she does. I'm so proud of you. Really am.
Oh, thank you.
You've come along a long way.
Oh, and I thank you and your office, your staff so much. You made it pleasurable. This treatment, you made it bearable. You made it tolerable, and yeah, you made it fun. As I said, I look forward to coming and seeing you guys.
Yeah. Yeah.
I really do.
And we look forward to seeing the celebrity every time. Again, thank you guys, as always, for listening to us, for tuning in. I appreciate you so much, Lisa.
I appreciate you more.
For being our third podcast, and we're excited to invite many more patients as the time goes by, and we're excited. Again, thank you so much. And Devani, as always, appreciate you for the questions, and I look forward to seeing you guys next week for our next episode. Take care.
Cheers.
Oh, cheers. There we go. Woohoo. Woohoo.